Namaste, ma'am.
Okay,
So all
you can welcome.
you can mute your phones.
Okay.
So good evening, everybody. I'm welcome everybody for our today's evening session. I'm requesting Surendra sir to take the session forward. Surendra sir, yeah, you can please unmute
Okay,
yourself.
okay.
Yeah, please.
Good afternoon. Welcome to elect members. Last few classes, I've been taking about medicines related with affections of cancer and other things.
Deepika,
See,
mute.
I want to stop to that,
Mute பண்ணிடு.
but every day news is coming. News is coming. Even yesterday, they say that prostate cancer. They repeatedly saying cancer, cancer, cancer. It is affected by children. It is affected to young people. So they are threatening. I think it is a high time that this news must be stopped. What if, whatever be, if cancer is there, whatever be there, let us undergo the peril. Why should these people come and trouble us? Okay. It's all in the game. Corporate sectors, corporate hospitals wanted to rule the people. There are many WhatsApp users which says that there is no control over there. And another way, the government says we have to contain all those things. I don't know when it is. People are going to be helped. I don't know. They must encourage the alternative system of medicine. Homeopathy, Unani, Siddha, Ayurveda, Reiki, pranic healing, all these methods for us. You may ask me whether such things will prevent cancer, such things will prevent COVID. No doubt in that. We have faced whoever has come to the homeopathic field, they have survived the chronic COVID infection. Yes. Today, you see, I want to say one more thing. This artificial intelligence as well as 3D animations are entering into this treatment of allopathic field. Particularly, this 3D animated videos helps the people to overcome the critical surgeries. It is called congenital heart diseases or cardiovascular diseases as the case. The concept here is that this will enable the surgeon to precisely see the place of origin of disturbance, which even after MRI scan other things they could not find out. When they enter into the actual surgery, they encounter all these problems. This 3D animation helps the surgeons to know about the precise place where the troubles are there, and they can easily discuss themselves with their teammates and tackle the subject. Like that, 3D animations for liver disorders, lung disorders, and brain disorders, they are going to use it. I don't know what is going to have the future reactions or affections. Nowadays, you know, for this Alzheimer's diseases, they have come out with artificial intelligence applications. They send the nerves to the brain and thereby see where the weakness of the nerves are there. So they give medicines. So you are slowly overcoming the disease by therapy. What happens to this artificial intelligence? Recently, they have applied this to the diabetic concepts.
இது இல்லையா
They say
இல்லை தனியாக இல்லை இருக்குது. நான் இப்போ யூஸ் பண்ணுறது இருக்கு.
they can handle
நான் இப்போ ஒன்று ஊருக்கு போகிறேன்னு வாங்கலை.
the exact causation of disturbances, and also this type of therapy can heal the foot problem. That is, you see, chronic disease, chronic diabetes will get this ulcers in the stomach. They'll be having difficulty in walking and swollen limbs, etc., etc. All these things are they are trying to overcome. I don't know what is the cost of it and what is going to be the after effect of this. This is for your information. I am giving you. Yes. We are on a different footing because whatever we learn
நமஸ்காரம்மா.
in the modern way,
நீங்க அது வந்து அலோபதி
whatever we know about the
ஃபங்கஸ்
allopathic system
டீப்பா
or other
போயிடுச்சு.
systems
ஏதாவது
or
நீங்க
therapies,
ஆன்டிபயோட்டிக் கொடுப்பாங்க.
we should not lose sight of our
அந்த கிளீன்சர் கொடுப்பாங்க. ஒரு வாட்டி
homeopathic
டாக்டர் பாருங்க.
way of medicine.
ஆமா.
What is it that
உள்ள டீப்பர் போயிடுச்சு.
homeopathy says?
நெயிலோட ரூட் இருக்குது பார்த்தீங்களா? போய்
Homeopathy says
அப்புறம் விரலெல்லாம் வலிக்க ஆரம்பிச்சு. ஒரு வாட்டி காமிங்க.
you have to
இப்போ இருக்காது.
apply your mind
ரூட்டுக்கு போனப்போ வரும்.
by your abundant
அதுக்காக ஒரு வாட்டி காட்டுங்க.
knowledge in the
அதான் ஒரு வாட்டி காட்டுனீங்கன்னா
homeopathic
ஃப்ராங்கில் யூஸ் பண்ணலாம். அது வரலாம்.
and
இந்த டாக்டர் கிட்ட
therapy,
ஃப்ராங்கில்
etc.,
யூஸ் பண்ணுங்க.
as well as your experience.
ஃப்ராங்கில் நைட்டு பகல மார்னிங்.
How do I
ஒன்றும் ஆகாது.
tackle it?
இல்லை நீங்கள் ஃப்ராங்கில் மார்னிங்
How do I
டாக்டர் கிட்ட போய் ஒரு வாட்டி காட்டி
tackle it?
ஃப்ராங்கில் போட்டால் பாதி குறையும்.
Comes
அப்போ காட்டி பிரயோஜனம் இல்லை. இப்போவே காட்டி
Yeah.
ஒரு வாட்டி அது என்னன்னு சொல்லுவார் பாருங்க.
Million
தெரிஞ்சவங்க ஃபங்கஸ் மாதிரி இருக்குது. அவர் என்ன சொன்னாங்கன்னா ஹோமியோபதி மூலியமா முடியும்னா
more you
பண்ணிக்கலாம்.
tell,
பெட்டர் அலோபதி. இதுக்குன்னா அந்த ரூட்டு போயிடுச்சுன்னா நகையே இருக்காது.
you succeed. You may fail
நகையே
in one or two
போயிடும்
cases.
ரூட்டுக்கு போயிடுச்சுன்னா. ஆமா ரூட்டுக்கு போனாதான் இப்ப அது
person
மறுபடியும்
must
கவனிச்சு
know
ரூட்டுக்கு போய் டச் ஆயிடுச்சுன்னா மொத்தமா நகையே
What is
இருக்காது.
the patient? His condition. What we must do?
ஐயோ யார் நார்மல்
Suspected pathology and
டெர்மட்டாலஜிஸ்ட்
emergency.
தெரிஞ்சா அவர்கிட்ட போகலாம். வேண்டாம் வேண்டாம் வேண்டாம்
See,
ஹாஸ்பிட்டல்
there
இல்ல
are
டெர்மட்டாலஜிஸ்ட்
number of diseases
டெர்மட்டாலஜிஸ்ட் தெரிஞ்சு அவங்ககிட்ட போகலாம்.
expressed by the
தெரிஞ்சா போங்க இல்லைன்னா வேண்டாம்.
you link yourself.
இல்லைன்னா ஆர்டினரி டாக்டர்
Stomachache, indigestion,
இல்ல நான் இப்போ கிளாஸ்ல
frequent
இருக்கேன்.
headache,
நான் ஹோமியோ கிளாஸ்ல இருக்கேன்.
uneasiness,
நீங்க ஏதோ ஒரு டாக்டர் கிட்ட போய் பார்த்துட்டு வரலாம்.
body weakness,
Thank you.
and constipation, sleeplessness. He says all these things. Physician must understand and he must ask a precise question. Since how many days you are having disturbance of the stomach? Sir, it is for more than a year or so. Definitely, when there is a disturbance in the digestion, when there is a disturbance in the process of assimilation and in the absorption, you lose your absorption of the energy. So when the energy is not properly absorbed day to day, what happens simultaneously? Your circulatory system, your activities, nervous system, everything gets weakened. When the nervous system gets weakened, what happens alternatively? There's a indigestion, vice versa. Indigestion, headache, because you are not able to have sufficient energy, and you have taken lot of medicines. Still it has not helped. The more you take the medicine, you feel better, but it is again coming back and disturbing you, numb and then. No, they have come to the place where actual problem has started, that is stomach. Then you go deep into the stomach. What is your family background? He will say, my mother had this, my grandfather had this. They were all having lot of problems. With the age advances, their digestion system is not normal. So now you know their picture, whole picture. You can start it with Carbamazepine Lycopodium China. Safest way. For a week. I tell you, it will not help. Because it is chronic. Plus, it has come to the patient through his parents. So now the physician has no clear. Then he goes for his diet habits. Yes, sir. I am a chronic eater of biryani and other non-vegetarian items. I cannot have a meal without that. I am taking medicines as well as I am taking. That means he is not stopping the stomach from becoming more and more ulcerated or more and more disturbed. Understand? Now you know most of the Carbamazepine Lycopodium China. When it is given, it will give him some solace. After a week or 10 days, he will say, sir, I am better, I am not completely all right. Yes, he will not be completely all right. So you go for the chronic medicines. Merixol, anacardium, when there is a stomachache, anacardium, borax, oriental golem, chiminum sulf. Then you can go for still deeper remedies, sulfur. But while administering sulfur, you must be very careful. You must treat it with Merixol and try for remedial measures. If it's not completely all right, you go for sulfur. You go for Sorinum, mother tincture. You go for Hydrastis canadensis. You go for the stomach combination in the homeopathic manufacturers. It's good, Lycopodium, higher potency. You can go for China, higher potency. because the circle must be repeated. We should not go for Soralier, Bergson or sulfur continuous. You must give gap. Then you go for carbons like higher frequency. Or you go for calcarea carbon. The best medicine is Hydrastis canadensis. Then you also can go for Chelidonium. Sir, why are you telling about Chelidonium? Yes, because of the disturbances, his liver is also affected. His liver is also affected. So you must bring back the liver also to normal condition. So Chelidonium intermittently. So this is the long treatment that one has to give. The patient has to cooperate with you for more than 6 months to 1 year. Then afterwards, he can take whatever. He can even take the stone and digest it. Because his bowels, his stomach muscles, his stomach layers become completely normal. Completely normal. There are other medicines also according to symptomatology. There are about 200 to 300 medicines that touch upon the stomach alone. Stomach alone. So, this is a management. The patient must cooperate. So, you go for the pathology, you go for the history of the background, you know that it's not merely the other symptoms that carry, only the stomach that is completely to be cured, he will be completely all right. This is one way of treating the patient. There are many concepts of how much potency you must use. In this chronic case, I have said, you can go for LM potency also. LM. You can go for higher potency too, CM, etc. There are many aspects that's covering upon the treatment of the patient. Supposing by way of suppressive medicines, the patient gets all his diseases suppressed. He will come and say, sir, I am all right so far as I take this medicine. But when once I leave it, within 3 days, I feel the very same trouble. The medicine that is given is only suppressive. So it will contain the disease force or disturbing factors. Thereby, the patient feels normal. Or whether the patient is normal even with the suppressive medicines? No. He cannot be comfortable because the suppression, previously it is 80%, afterwards it is 75%, afterwards it is 65% as the case. Like that, the higher the medicine, the lower the suppression takes. One day, even the medicine will not work. Sir, are you exaggerating? No, I am not. I am not. What their system of medicine is, that is, according to the clinical tests and laboratory tests, they found out the medicine, these chemical combinations will help, so that is helping. But it will not help for the long run. It will only help for a limited period, because unless the root cause is removed, What is the root cause? Internal malady. What is the internal malady to be done? It has to be excited out, exhibited out. So you have to choose medicine according to the symptoms as well as the conditions. Here, the family background, likes and dislikes, modalities, these are all the additional factors for a homeopath to decide the also. With all this, do you mean to say this homeopath will tackle every case of affection, infection, or disease? We have got our own limit. When the organ goes beyond repair, that is fully damaged, only surgery is the remedy. Surgery, for example, appendicitis, hernia, you give medicines, no doubt. For hernia, you are healing them, but still the morbidity factor that goes and says, and even after the medicine, higher potential like that. Tonsillitis in children, in a chronic cases where their hereditary is that they got problem with the lungs and throat conditions. I have experienced a very critical
Yes,
case
ma'am.
in
Is that
Malapur.
Yes,
A
sir.
small child about
liquid,
7 to 8
Is that-
years.
Liquid
He
pills
has
for
been brought for very tonsillitis. They say I don't want to go for surgery.
I don't
Even
want to
the
be
doctors
surgery.
have suggested for homeopathic treatment.
8 by 21, sir.
Oh, I think-
8 by 21.
No good to
3 years.
The child has
24.
got
3
the
years.
root cause of
Yeah.
progeny
நல்ல விட்டு விட்டுருங்க எனக்கு எத்தனை ஒன்று தான்
ancestral
அதிகம்
fault,
போகிறதுக்காக பார்த்தேன்
So I said, tackle it.
எப்போ
sulfur and other things.
21
I was hesitant to
8
take
இது இருக்குது
sulfur.
இன்னும் 6 மாதம் 8 மாதம்
அப்போ நான் சாப்பிட்டேன்.
இப்போ ஒரு 1
No,
வீக் ஆகும் அவ்வளோதான்
patient, due to his urgency, has got the tonsil operated. And he said, sir, because of urgency, I have done it. Because the child has to go to the school and he has to study. Has
110 கொடுங்க போதும்
அதான்
இல்லை 10 ரூபா நீ நான் கொடுக்க
Nowadays, many combinations have come. I am telling you about 20 to 25 and back.
100 கொடுங்க மறுபடியும் 10 ரூபா இருக்காது
Incident. Today, even in homeopathy,
நானே 100 கொடுங்க
many combinations are.
இது
So,
சொல்றது
many medicines are there that don't tonsil.
தேங்க்யூ சார்
Also,
உங்களுக்கு
even
நிறைய discount கிடைக்கும்.
tonsillitis is also linked with the parentage.
இது
all this-
ஆஃப்டர் சாப்பிட்றதுனால
Future.
கேளுமா
With all this, we are going to acquire more new diseases. God forbid. But it is inevitable because environment changes, environment causes.
அதுக்கு ஆப்ஷன் சார்
We are
அதுக்கு ஆப்ஷன்
certainly bound
அப்புறம்
to
கேட்போம் ரெக்கார்ட் ஆகும்
face all those challenges. What is suppression? For example, a person is bitten by spider. Lenapol was given. There is inflammation that night. Then discharge occurred. I was also thinking that it is a medicine that are given for suppression or curation. But simultaneously I have given Silesia. So what happened? There is no suppression and cure has taken place. Two aspects are in. Two aspects. When there is an injury, the sharp instrument. It's a Leadenhall was killed. Leadenhall is no doubt in medicine, but simultaneously, Apis mellifica is also should have been given, because Apis mellifica will remove the poisonous aspects. Afterwards, Silicea can be given so that the poison will come out through the small little pores. These are the simple medicines. See, accidentally a patient got injured in the finger while hammering with a nail. Nail has bitten the damaged his finger. They have gone to the first aid and other things. After all the treatments, it has swollen. We are given the drug for 200 bundles, followed by Silicea. Third day, the swelling has gone and oozing has come out, and on the fifth day to seventh day, there's a complete cure. Sir, you are telling about small things. What about the chronic conditions, complicated cases? They also has to be taken systematically, step by step. It can be done by only a physician, homeopathic physician, who knows the or who has a good background, who understands the present scenario of the patient, visualizes it, and then he decides as to how to treat it. This will effectively lead to the complete cure. The good aspect in homeopathic treatment is it not only removes the morbidity, it will strengthen the vital force. The vital force harmoniously goes and occupies the places and rejuvenates, gives the strength. When the strength is given back, so you take Horlicks, 2 cups of Horlicks. What happens? Immediately you feel very agile. Sir, I feel I want to run. A old man in the hospital, when he is given 2 pints of blood transfusion, he told me, sir, I feel like want to run. That is the vital force. That is what the homeopathic does. So, there is no second opinion on the homeopathic system of cure. Only how you administer your efficacy, patient clarity. Thank you very much. I'll hand it over to Mr. Anand. Thank you very much, sir.
Thank you, sir, Surendra sir. Now I will continue the class and Murthy sir will join after that. Just give a minute. So in continuation to this disorders of menstruation, last week we spoke about, we discussed amenorrhea. Today we will be discussing premenstrual syndrome, irregular periods and metorrhagia. These are all 4 parts of the menstrual syndrome. And the premenstrual syndrome, this is important because we should know about the PMS, the premenstrual syndrome. We have ladies at home, we have people at home. who had been suffering without really telling us, so we do not know what is happening into their day-to-day lives, without understanding the reason why they behave differently, or what is making them sad or happy, or mood changes. All those things will be known only when we know the reason of this, what is happening inside them. So premenstrual syndrome refers to the physical and emotional symptoms that occurs in 1 or 2 weeks before a woman's period really shows up. The symptoms often vary from women to between women, and subside around the start of bleeding. When the bleeding starts, these symptoms subside. So before the actual periods, they'll have different type of symptoms, mood changes. The common symptoms include acne. They'll have pimples grown, pimples seen on their face and back of their chest and on the back side. They will be having pimples. Acne will be there. Tender breast. The breast will be painful. Tender breast. Bloating. Their stomach, they'll feel like it will be blown up like a balloon. They'll feel tired. They'll have irritability. Mood changes will be there. Often these symptoms are present around for 6 days before the periods, like that. So these are the symptoms what we are going to discuss. So there is another little more complicated one. It's called premenstrual diasporic disorder. It's a more severe form of PMS that has greater physiological symptoms. The causes and risk factors of this thing. The exact cause of premenstrual syndrome is unknown, but several factors contribute to this condition. Cyclic changes in the hormones. The sign and symptoms of premenstrual syndrome changes with hormonal fluctuations and disappear with the pregnancy or menopause. So when they are pregnant, they will not be menstruation, and if the menopause happens, they will not be having menstruation. So when there is no menstruation, these syndromes will not be there. So premenstrual syndrome, it is a physiological thing. Psychiatric and psychological history will be there. The symptoms are worse before menstrual starts. No, it is maybe without relation to menstruation. So it's premenstrual exacerbation of primary disorder. If the premenstrual syndrome is there, we have to address it like that. It is just a picture diagram how to handle it. So premenstrual syndrome, the chemical changes in the brain. Fluctuations of serotonin. Serotonin is a chemical that's a neurotransmitter that is thought to play a crucial role in the mood state which trigger the premenstrual syndrome. So when this brain chemical called serotonin, which is not there in proper levels, the mood changes happen. Insufficient amount of serotonin may contribute to premenstrual depression as well as to fatigue, cravings of food, and sleep problems. Insomnia will be there. So if the correct levels of serotonin is not produced inside the brain, they will have these sort of issues. So the chemical manifestation is emotional and behavioral symptoms. They'll have tensions or anxiety, depressed mood, crying spells, mood swings, and irritability or anger. They will have these sort of symptoms which will be expressed by this thing. Appetite changes will be there, food cravings, trouble in falling asleep, that is insomnia, social withdrawal. When they have these sort of problems, they will not mix with people, they will want to withdraw from the society or sit alone, and they'll have poor concentration also. These sort of confusions will be there undergoing by them because of this hormonal changes. So physical changes and symptoms. They'll have joint pains and muscle pains, headache will be there, fatigue will be there, weight gain related to fluid retention because they will be accumulating unwanted fluids inside the body without urinating it properly. Kidneys won't be removing it, so they'll have fluid retention. Abdomen will feel bloated, breast will be tender, and they'll have acne and constipation or diarrhea, whichever may be the case. They'll have these sort of physical symptoms for that. You can see they'll have a lot of confusions, they'll have bad mood, breast will be swelling, headache will be there, nausea will be there, they'll have emotional swings, diarrhea or constipation, they'll feel like overeating, eating and then overeating, acne, they will have many other like stomach disorder and bleeding starts. Another picture, this again, bloating, irritability, backaches will be there, headaches will be there, breast soreness, anxiety, depression, excessive fatigue, food cravings will be there, acne, feeling stressed, insomnia, constipation, diarrhea, and mild stomach cramps will be there. These are the things, the other symptoms of these premenstrual syndrome. So diagnostic value. There is no unique physical findings or laboratory test to positively diagnose premenstrual syndrome. So this is the feeling which the person has to have. There's an experience and it cannot be tested and found out what is the reason and how much they are suffering. Then there is the management part. An allopathic system of management is antidepressant, selective serotonin reuptake inhibitors. So they will have the reuptake inhibitors. That means the serotonin will be there inside the system, have successfully been used to introducing the mood of the PMS and PMDD. Some women may need it just for 2 weeks before menstruation bleeding starts. So if you give antidepressant, they will be able to manage this issue temporarily. The non-steroidal anti-inflammatory drugs taken before the onset of periods can ease the cramping and breast discomfort. So NSAID will also help them to come out of this problem when they have this sort of discomforts. Diuretics, because there is water retention, the woman finds that exercise and reduced salt intake is not enough to reduce weight gain. So even after taking less salt and reducing their exercise, increasing their exercises, their weight gain is not reduced. So they will have swelling and blotting of PMS. Diuretics, that is water removing drugs, can help to remove the excess water and urine and easing the PMS symptoms. Then hormonal contraceptives. These work on ovulation and stop it. Ovulation and stop it. So oral contraceptives will stop the ovulation, and when there is no ovulation, the PMS will also will be stopped. Then when it comes to our system, homeopathic methods, we have a lot of medicines. Calcarea carb, if it is a suitable drug to the condition of the lady, then when she has headache, colic, and damp feet, she will feel feet is wet, and better in dry climates and lying down. Worse by mental and physical exertion, should be worse, and in cold also. So that is calcarea carb. Lachesis, here the breast will be inflamed. She will have hot flashes of heat, headache and fainting spells will be there. Better with warm application. Worse by pressure of clothes. Even when the clothes will be, if she wears tight, she will have problems. So worse by pressure of the clothes, and after sleeping also she will be bad. So lachesis is the indicated drug. Lilium tig. Lilium tigrinum is a medicine for this sort of PMS syndrome. Pain down the thighs. Pruritus is itching all over the body, itching on the legs. Pruritus, so it will work with lilium tig. Then better in fresh air and worse in warm room. Lycopodium, pain in the right ovarian region, burning sensation in the vagina, better with motion and being uncovered. Worse lying down. Natmer, Natremuritum, Moriaticum, irregular periods, usually profuse flow, better in open air and pressure against the back. Lying will worse by lying down. Naxomica, extremely impatient, pushy and intolerant patient, nagging urge to pass stools before the flow begins. Constipation will be there, constriction pains extending to the rectum or to tailbone region, anger, mental strain, physical exertion, and craving for coffee. Better by sleep, warmth, and strong pressure. Worse with alcohol or eating food. Worse in the morning and after mental exertion. Alcohol is mentioned here because all over now there is a tendency for everybody taking little of alcohol, and that is why that is also mentioned as to be avoided. Pulsatilla, helpful to girls who have recently started having periods. Irritability, moodiness, weepiness are typical. So when it's a newly adolescent girl, she is having these sort of problems, then Pulsatilla will help her. Delay or suppression of menstrual flow can be accompanied by this quasi feelings, uneasy feelings, nausea, faintness, feeling downward pressure. Also may have diarrhea, better in open air and from motion, worse in heat and warm room. Sepia, period often late, sickness in the morning, and vagina may be painful. Better by exercise, pressure and warmth of the bed. Worse in the morning and evening. General care to reduce PMS, premenstrual syndrome. General care, what all to be done? Modified diet. Eat smaller amount, smaller, more frequent meals to reduce bloating and sensation of fullness. So eat small portions of food many times. Limit salt and salty food to reduce bloating and fluid retention. So if you reduce your salt, you will feel much better. Choose foods high in complex carbohydrates, not simple as rice and wheat and all. These are simple carbohydrates. Sugars are simple carbohydrates. If you use complicated carbohydrates like low glycemic index or carbohydrates which are seen inside which are found inside our grams, such varieties of carbohydrates are complex, and carbohydrates such as fruits, vegetables, and whole grains. So in those, the carbohydrates will not be easily available to release into glucose, so that is good. Then choose food rich in calcium. If a person cannot tolerate dairy products or is not getting adequate calcium in their diet, a calcium supplement may help. So calcium rich food or calcium supplements can help. Avoid caffeine and alcohol. Again, to feel better, avoid caffeine and alcohol when you are having PMS. Then incorporate exercise into your regular routine. So if you do good exercise, you will feel better. Engage in at least 30 minutes of brisk walking, cycling, swimming, or any other aerobic activity most of the days of the week. So if you do good exercise and aerobic exercise, your PMS will definitely come down. Regular daily exercise can help to improve overall health and alleviate certain symptoms such as fatigue and depressed mood. So when your system is well exercised, you will not have tiredness and depressed mood will not be there. Then we have to reduce stress. Plenty of sleep is required. Practice progressive muscle relaxation, deep breathing exercises like muscle relaxation will be like a meditation. Deep breathing exercises to help reduce headache, anxiety, or trouble in sleeping or insomnia. So these sort of muscle relaxation techniques have to be practiced. Meditation and breathing exercise. Then try yoga or massage to relax and relieve the stress. So yoga will also relax the stress. Massages also will relax the stress, so that can be done. Then the other thing is to keep a record to identify the triggers or the timing of your symptoms. Like when does it happen, and why does it happen, or anything is triggering the symptoms and all. You can keep a record so that you can either discuss with the doctor or you can avoid those situations so that the PMS will not recur. So this is about PMS. We will discuss the next one. Irregular periods. So we know periods are there and there is a regularity. So what is or why is it called irregular periods, or when can you call periods irregular? A lady may be having a fixed periodicity of menstrual cycle. It may suddenly arrive early or delayed or get delayed. Sometimes, like it would have been constantly 28 days or 23, 25 days, 29 days like that. Suddenly it will be delayed. The period may be from 21 to 35 days, maybe different people will have different type of periodicity. So 21 days to 35 days will be there within people. The number of days of actual flow can vary from 2 days to 8 days. So these are all common. These variations can be treated as normal and depending on the external environment. So external environment manages or plays a lot of role on the period flow and period days. So if it is 21 to 35 days and the actual flow is within 2 days and 8 days, this can be called as normal periods. But if there is no external reasons, that is, you are doing a routine job every day, the same thing at home or working, or small sort of, there is no stress and exercise and additional mountain climbing or trekking or something like that, or cycling or doing some hard work. Nothing is there, and there is some sort of change. That means there is a variation. And but if there is no external reasons and there is a major variation, sudden decrease or increase in the gap between the periods, or there is excessive blood flow, or just scanty or spotting only,
Still on to the.
then there is it is called irregular periods. The actual flow days are reduced to a day or two, or extended more than 7 to 9 days. We can term this change as irregular periods. So now we know what is irregular periods. The causes of irregular periods, it is purely hormone controlled, and the rise or fall of the amount of major female hormones, estrogen or progesterone. So when these two female hormones may be high or low, then these sort of irregularities will happen, and this will bring the drastic changes within the period flow. Variations in the common, these variations are common during the menarche, that is the start of the periods, and in the puberty time when they start, or the menopause time. The use of intrauterine birth control nowadays, it's not nowadays, it has been always there. There is an intrauterine device which can be implanted inside the uterus to avoid unwanted pregnancy. So use of intrauterine devices to control birth is one of the reasons to have irregular periods. Change in birth control medicine. So if there is, if somebody are using oral contraceptives, and if they change the brand or change the type of medicine, then also the periods can become irregular. Then heavy physical exertion or exercise. If you have to, go for a mountain climbing or some sort of hard work, or jogging or running suddenly or something like that, that also can, cycling or something which is exerting your body suddenly can cause these sort of irregularities. Then if you have polycystic ovary disease, then the changes will be there. Breastfeeding, if you have breastfeeding also, your periods can be irregular. Thyroid disease, maybe it's hyperthyroidism or hypothyroidism, both can cause this sort of changes. Uterine fibroids, if there's fibroids inside the uterus, or if you are gaining weight so much, or endometriosis or adenomyosis, these are all some causes which can cause irregular periods. So like 21 to 35 days, within 21 and within 35 days, it's called normal. And if it is longer than that, then it is called irregular periods. So homeopathic medicines for irregular periods, we have Jonesia asoka, delayed and irregular periods. This is the combination medicine I said before. Delayed and irregular periods, menstrual colic, also cures amenorrhea, pain in the ovaries before flow, menorrhagia, leukorrhea. So this is for Jonesia asoka, can be used for all these things. Then Abroma augusta, so it's a uterine tonic, congestive neuralgic dysmenorrhea and amenorrhea. So if you mix both together, and both mother tinctures together, and take 15 drops of that, 15 to 20 drops of that in quarter glass of water 3 times a day, 1 week before the period, and continue through the periods, then your irregular periods will be subside slowly, and the coming periods onwards, it will become better. Then we have a best combination for in homeopathy, it's called bio combination number 15. 4 tablets for a month will do the needed correction, and menstrual disorders for both young and older ladies, this will work. So another thing is sepia officinalis, irregular menses, too late and scanty, violent stitching pains upward from the uterus to the umbilicus. So the pain goes upwards from the uterus to the umbilicus. Pulsatilla, amenorrhea, too late and scanty, clotted. Then Abroma radix, leukorrhea, dysmenorrhea, and irregular menstrual cycles and flow. It tones the ovaries, uterus, and vaginal mucosa. It acts on the uterine as a uterine tonic also. Then calcarea calf, too early menses, profuse. Breasts are tender, headache, leukorrhea. These are selected once the constitution and character of the remedy matches to the patient. Now, metrorrhagia. Metrorrhagia is another confusion problem which the ladies encounter nowadays, and that is periods between periods. So metrorrhagia is a bleeding between periods. The uterus between periods and lasts more than 7 days, or will be just spotting between periods. This is common problem. This is a common problem, especially for teenagers and women nearing menopause. Metrorrhagia is also called intermenstrual bleeding, abnormal vaginal bleeding, or dysfunctional uterine bleeding. So these are the other terminologies for metrorrhagia. The vaginal bleeding that happens outside the normal menstrual cycle is metrorrhegia. So normal menstrual cycle will be the 21 to 35 days. So this will be between those days, there will be some spotting or bleeding. So sometimes this bleeding occurs due to lifestyle factors like stress, weight loss or travel, but it can also be due to hormonal changes, medication and certain health conditions. So these are the causes now. The type of bleeding can have many causes, some of which may be serious than others. The type of treatment will depend on the cause and specific needs for the person experiencing the metrorrhegia. So that is how. So ergeron canadensis is the hemorrhage from the uterus, metrorrhegia with violent irritation of the rectum and bladder, prolapses of uteri. Then a bright red flow, menorrhagia, profuse leukorrhea with urinary irritation, blood flow in gushes with least motion between periods. So this is the indication of ergeron. Millefolium, menses early or profuse, hemorrhage from uterus, and bright red discharge. So millefolium is for menses to be early and profuse. Then hemamalis, metrorrhegia occurring midway between menstrual periods, uterine hemorrhage, menses very sore and dark and profuse. Vicarious menstruation also will be there. The Lapsi bursa pastoris, too frequent and copious menstrual flow. Blood is dark blood, offensive and stains indelibly. So this stain which will stain your clothes, the stain will not easily be removed and scarcely recovers from one period. It's like periods are continuous. It will not, when you before you recover from one period, the other period begins. Violent uterine colic and leukorrhea before and after menses. So this is a continuous problem for the lady, and the Lapsi will be one good medicine for her. Sabina, menses profuse, right, leukorrhea after menses, corrosive and offensive discharge from of blood between periods. Then menorrhagia in women who abort readily, like anytime she gets pregnant, she has a tendency to get aborted, and Sabina helps there. Then inflammation of the ovaries and uterus, hemorrhage partly clotted, worse from least motion. So when just slight motion is enough, bleeding will start. So that is Sabina is indicated there. Terebinth, intense burning in the uterus and ovaries are very painful. Ovarian dropsy, metrorrhegia with terrible burning in the uterus. Bio number 15 again, irregular menses, bright red if early, dark if red is late. Scanty in young girls, excessive in elder women, and painful menstruation. So in the series of this menstrual disorder, we will be discussing dysmenorrhea and dysmenorrhea, which is painful menstruation, and menorrhagia, heavy flow, prolonged menstruation reading in the next session. Thank you all. We will discuss. We hand over to Moses sir or Suresh sir. Thank you, sir. Suresh sir, or Surendra sir, or Moses sir, like. Moses sir?
Yes, sir.
Yeah, you can continue. Suresh sir is there or
no? Suresh sir will not come today.
Okay, then you take over.
Yes. Is my voice audible?
Yes, sir. Yes.
Namaste, my dear homeopaths. Thank you very much, Surendra Garu. You have taken excellent that one. And Anup Kumar sir, he has taken menstrual disorders, what I am always talking about it. Today, along with Anup Kumar sir's notes, I want to tell you something about the medicines, what are useful for menstrual disorders. First and fundamental is Calcarea corn. Menstruation is abnormal, early, profuse, last long for too many days. That is, time is also irregular. It is will not come proper time. Suppose 5th and 6th will come, means it will not come 5th, 6th, after 4 or 5 days, this way, that way. At that time, Calcarea corn we have to give. But for that, in 30 potency, it doesn't matter. If you want to go higher potency means you have to take the constitutional points also. That is, their appearance will be fair, fat and flabby and obese, where to whatever the small work they will do in the house or going somewhere or walking and everything, they will get somewhat wheezing type of breathing. That we have to see. And first, that is a constitution type of prescription means Calcareacorb we have to give. Otherwise, we are having two best medicines for menstrual disorders. One is Pulsatilla. Topper will be the Pulsatilla. It is useful with an amenorrhea, leukorrhea, dysmenorrhea, difficult labor also. At the time of pregnancy, at the time of delivery, this will be working. That is, it is very useful for amenorrhea, that is stoppage of menses, leukorrhea, that is white discharge, dysmenorrhea, that is the stomach pain during the menstrual period, and difficult labor, that is at the time of delivery. When the baby is reversed, at that time also Pulsatilla will work excellently. The patient is mentally indecisive, changing moods, timidity, mildness, and very, very obedient, fearfulness, weeping tendency. Menses are very scanty, delayed and suppressed, generally by wetting feet. This is one of the main symptoms here. Menses flow will fits and starts. It will come, stops, come and stops like that. Very useful for caloric, that is anemic patients. So anemic patient, previously I told chlorosis last time, what we have to give in ferrums, ferrumphos and ferrumet, aletris fernosa and alfalfa, those things we have to give. Here along with that Pulsatilla we have to give. And next one is Sepia. Our Anup sir has told that one, premenstrual syndrome. It is one of the best remedy. Sepia is for premenstrual syndrome, excellent. It is also useful for amenorrhea, leukorrhea, dysmenorrhea. Only thing here, mentality, if you see, they will have some irritation or some mood swings before menses starts. The symptoms of relaxation is the more marked everywhere in Sepia. Everything relaxed. Due to this relaxation, there will be a prolapse of uterus, and constant sense of pressing into vagina. They will cross the legs. Always Sepia people cross the legs. They think because of crossing the legs, they can prevent the prolapse. That is only mental feeling. Bearing down sensation, as if everything will escape from the vaginal canal. Menses scanty, appears late every month. That is spotting. Sometimes spotting will be there. Menses may not come. Yellow saddle across the nose and cheeks. There is a lack of vital heat. Generally, Sepia people will be lean, flat chested. By seeing the appearance itself, we can see who are the Sepia patient, who are the Pulsatilla patients. Pulsatilla patients, they want to reveal everything. By that way, the consolation they like. Here in Sepia, consolation they don't like. They react. So another thing, Anup Kumar has mentioned this one, Lilian trig. Lilian trig is one of the best remedy for leukorrhea, that is white discharge, where watery content will be more, yellowish, and the kapda, what we use, the clothes also become yellow or brown. And this leukorrhea is excoriating. And in Lilium trig, it seems uterus will be heavy. Whenever menses comes or menses goes, they will feel uterus area will be heavy. And dragging pain will be there. Along with that, you can give Lilium trig, and when dragging pain is there, you have to give Lilium trig along with magnesia phos. Next, Platina. Platina, menstruation is very profuse and clotted. Very early it will come. According to the date also, it will come 4 or 5 days before. The constant irritation of the sexual organs. In Platina, they will have so many desires in their mind, they will have so many plans to suppress other people. The other people's feelings they may not like. Those things. At that time, they will be very irritable, they will fight, and they will abuse so many people. The mental symptoms of haughtiness, self-esteem will be there for them. It is also one of the best drug, Platina metrorrhgia, that is dark, clotted and thick bleeding. And Cimicifuga, one of the best remedy for menstrual pain, that is dysmenorrhea. Along with uterine problems, they will always have some back pain or thigh pain or headache, preferably headache. The menstruation is premature and profuse. There will be pain in the wandering of back. This, whenever the dysmenorrhea is there, they will flatly sleep or take rest. But leukorrhea is a general symptoms along with neuralgic pain and nervous pain. Irregular, exhausting menses of dark clotted blood with severe backache. Wherever the backache is there, preferably ladies, don't forget Cimicifuga also. Sometimes they may not tell about that uterine problems, but generally any lady tells a back pain. Whatever the medicines you are taking, selecting Ledampal or Rustrax or whatever it may be, there you see after questioning, Cimicifuga is also one of the remedy to stop that. Generally, what medicines you will give for backache? Aesculus, Bryonia, Hypericum, Cimicifuga, Pitaloca, Arnica, Ruta, Rustrax, like that, whatever it may be. So according to the symptoms, if anything is tallies means you can give Cimicifuga also. Creosotum is one of the best remedy for menstrual disorders. Menstruation is copious, abdominal bloating will be there. Flow is very early and very profuse. The flow is very acrid, very offensive, excoriating the parts, private parts. Violent itching of the vagina will be there. At that time we have to give along with leukorrhea. At that time you have to think of creosotum. Next, Helonias. 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 It acts as a uterine tonic. It is one of the best remedy for anemic people also. Leukorrhea, which is dark, offensive, constant. Helonias leukorrhea, the person, the lady moves here and there means slight smell will come. That itself shows. Suppose in our family, any person is having some leukorrhea and they are having the smell where they are going, passing or this way, that way. At that time, if you think you can give few doses of Helonias, that will work excellently. If they satisfy, you can ask the other symptoms, you can totally cure all those things. General debility is very marked in Helonias. Helonias people are, because there are one anemic condition will be there, constant leukorrhea will be there, they will not tell that one. Third one is because of this proteinuria, what it is going, because of that one they will have low hemoglobin. By that way they will be always weak, tired. They will do little work, tired. They will do another work, tired, like that. For that, those people, Helonias is one of the way. Helonias not only curative medicine, it will tone up the system. Menses are too frequent and too profuse. And 15 days, 20 days menses will come now. For that, Helonias is one of the best remedy. And they are really having a debility always. And relaxed constitution, relaxed position of their body. Useful in worn out and tired women. It is useful for malposition of uterus. Next one, Aletris ferinosa, one of the best remedy, tired all the time. Menses premature, profuse with labor-like pains. Aletris ferinosa, I told, up to 25 to 20 years only, that too before marriage any persons are there, for them you have to give. This is one of the uterine tonic for younger ladies, younger girls. That is up to 25, 28. These people, generally they prefer only junk food. But proteinized food they will don't like. Only junk food they will like. Erratic food behavior will be there. They will not take proper food in proper time. For those persons, preferably our younger generation people, you can give Electris ferinosa. It is one of the best remedy for PCOD also, polycystic ovary disease. Menses premature, profuse, and pains will be labor-like pains. Uterine displacement will be there. Extreme constipation. While great effort must be required for passing the stool, and otherwise because of the extreme feeling in that, they want to stop the fishes, and they will postpone, tomorrow will go, or otherwise they will depend on pills for constipation. They create because of the heaviness. Great effort must be required for movement of the bowels. Digestion is also weak. Electris is just like a China for uterine region. Whereas any loss of fluids are there in homeopathy, we will give China. China, as it was like that, some medicines we will give to bring back their original energy or strength, whatever it may be. For that, for ladies, Electris ferinosa is just like China for uterine area problems. Patient is tired, dull, heavy, unable to concentrate the mind, always debility. If they are sitting in front of you also, they will feel weak. They will not that much active. So for them, Electris ferinosa we have to give. If pathology report is there, you can see what is hemoglobin count, and any PCOD is there, how is their menstrual flow is there. By taking that everything into consideration, Electris ferinosa is one of the best remedy to give that. Because we are having 3 mother tinctures in homeopathy for giving toning up of uterine things. One is Ashoka. Our Anup Kumar has just now told, Ashoka is one of the best remedy. Genosia Ashoka, that is one of the best remedy. Start we have to give. Abroma, another remedy is there, that also. And the third one is Electris ferinosa. These 3 you can give 5 drops each. Excellent, it will work. But Electris ferinosa is meant for PCOD. That also you can remember. Electris ferinosa you have to give only younger children up to 25 or 28. Older females we should not give. And after this one, Fraxinus americana is one of the remedy that you can give. If any person cross 28 or children, there are children, women are coming after 2 children or 3 children, whatever it may be. At that time they are having uterus problem, means you can go for Fraxinus americana. Fraxinus, Fraximus, Fraxinus, Fraxinus, Fraxinus americana. It is also one of the best remedy for enlargement of uterus. When the childbearing is there, sometimes some ladies uterus will be enlarged. For that, Fraxinus will be given, because it is also tones up the uterine system. It is one of the remedy for fibroids also. Any fibroids are there, it is one of the best remedy for fibroids also. It is useful for in the enlargement of uterus. It often reduces to normal size, preventing any operation. Only thing we have to give a longer time, say about 1 month, 1.5 months, 2 months, like that. And you have to ask them to minimum exercise they have to do. They should not carry any bulky weights. Like that, we have to give certain points, and they have to take a good energetic food, preferably vegetables and fruits, and they have to use this Fraxinus americana. So the enlargement of uterus will be bring back to normal size, and their energy will be back again. It is very useful for uterine tumors. I told fibroids now, sometimes they will tell tumors are there, cutty, whatever it may be. Whatever problem they tell about uterus, if Fraxinus americana will work, that too above 30 years, and childbearing must be there. Here also prolapse of uterine is there. If you are high, it is bearing down sensation, prolapse of uterus is confirmed, means you can give sepia along with some other protein take. After that, Fraxinus americana, mother tincture is the most important. And dysmenorrhea, it is Fraxinus americana is one of the best medicine. Profuse menses and leukorrhea, cramps in the feet, cramps in the feet, cramps in the calf muscles. What is the medicine for generally cramps in the calf muscles? Cramps in the calf muscles, what is the medicine? Cupramate. So like that you have to select the medicines as far as female problems are there, menstrual disorders are there, you have to go like this. With this my lecture is over. Anybody is having any doubts you can ask. Anybody is having any doubts you can please ask. Otherwise I will ask one question.
Sir, I have one doubt, sir.
Yes sir. Yes madam.
Sir, that patient age is 26 years. She married, but she doesn't don't have children. Okay. She is suffering with the same what you said that uterine that fibroids and like that she told. So I know because of that delayed menses I prescribed Pulstila 30 and Bio 15 and uterine SBL tonic also. Okay, but that Pulstila 30 it may work or not, I don't know. Because shall I increase the potency or shall I change the medicine because she the constitution of that lady exactly matches to Pulstila.
Okay.
So shall I go for high potency or otherwise I go for that other medicines what you said, the mother tinctures and all, no?
You can go mother tinctures. How is that uterus? Any pathological report have you seen?
Yeah, she is having that uterine fibroids. Already some problem is there.
Then you have to give Aletris spirinosa. Please think about epismel also.
Epismel? That epismel normally 30 is enough or shall I go for mother tincture?
No. Mother tincture don't go. Only 30 is enough. Along with
pulse. 1 week? Shall I give for 1 week?
Yes. 1 week to 10 days you can give epismel. Along with that, some other medicine, supporting medicine you take, the symptom based. But Aletris spirinosa will work excellently.
That is that Aletris spirinosa, mother tincture only I have to give.
Yes, mother tincture only. And how is her hemoglobin? What is the count?
Yeah, hemoglobin also the normal. Before she is
normal means around 12? Above 12?
Yeah, more than 12.5.
Okay, 12 is okay.
Yeah.
It must be 14 because the age is very less. It must be 14. Okay, around, because nowadays the modern food is there now. For that only 12 will be there. So you can go for that. Epismel you have to start in the morning. After that any medicine is suitable to her. You see, Croton tick is also one of the best remedy for them. If symptoms tallies, Pulsatilla is the third medicine. Aletris spirinosa 10 drops morning and evening.
Yeah. Shall I continue along with Pulstila? I have to continue all these.
Yes, 3 medicines, 3 tier system only I told.
Okay.
Epismel starting, second one protein tick if symptoms tallies, otherwise you can go for a colopilum or whatever it may be. You see the remaining portion. How is her menstrual time, any pains are there or any leukorrhea is there, like that some points you will get it. In that points only you have to select the second drug. Third drug is Pulsatilla. Minimum 10 days you have to give.
Shall I continue that uterine tonic?
Yes. Whatever the uterine tonic you are selecting, any patent drug, along with Aletris spirinosa you have to give. Better to purchase ask them to take a uterine tonic. SBL is also having, so many companies are having uterine tonic, along with Aletris spirinosa, mother tincture, morning 10 drops, evening 10 drops.
Okay, sir. Thank you.
Pulsatilla you have to stop when the period starts, sir?
Period starts, you have to stop. All medicines you have to stop. Only medicines, 2 medicines you can give. Only magnesia plus 100% you can give when menstrual flow is there. Sometimes if the abnormal pains are there, Simicifiga I can give. But Pulsatilla, Sepia, you have to stop everything. Because natural flow has to pass. We should not obstruct with medicines.
Okay, sir. Thank you, sir.
Any doubts, sir?
No. Sir, nowadays in the mid-age, most women, they get these problems of bulky uterus, fibroids in uterus and cyst in ovaries.
Wow.
Nowadays it has become very common. And the moment the ladies go to gynecologist, they do a scan and they say, you remove the uterus and all internal organs.
Yes.
This is what they say. They scare them and they immediately do.
Oh.
So can we give as a general medicine this what you call Fraxinus
America? Yes. Fraxinus America, you have to give minimum 1.5 months, 2 months. Along with that, you think about epismel, palladium, 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 and Sabina or like that, some other medicines you can give. You select the 2 medicines I have told. Third medicine depending upon the symptoms you have to ask. And Platina will work after 35 years. Excellently, it will work. You see their mentality.
We have to give in mother tincture.
Which one? Fraxinus you have to give mother tincture.
Mother tincture.
Yes.
Fraxinus americanus.
Fraxinus americana, you have to give mother tincture 10 drops morning, 10 drops evening.
First thing is to convince them that don't go for operation. That is
the most important. You ask the time for them. You give 1.5 months, 2 months. Afterwards, whatever you want to see, you can do. Before that, they will change. Guarantee they will change.
Yes, sir. Okay.
Any doubts, sir? One important thing I want to tell regarding me. Next Sunday and that is 18th and 25th I will not come. I am going to my native place. So if at all if I attend, I may attend the question hour. So please excuse me, I am going on leave.
Take care, sir. Have a nice trip.
Thank you. My native place I am going. This is the only information pass on to you. If possible, if everything permits means question hour I will come. I will not leave our elite group discussions. Number 1. Number 2, any question shall I ask? Anup Kumar.
General discussion, sir. Yeah.
Sir, I have a doubt.
Yes, sir.
Sir, this I am
Go ahead,
speaking
sir.
from Delhi. Recently there was a cold spell, and because of that there was a little bit of COPD problem. But there is no chest congestion. The COPD has subsided, but subsequently I find some white mucus. It irritates, it joins at the throat and then it irritates. It is not continued, it is sporadic. So I was just taking Bryonia, but that doesn't help. But I was thinking naturally I can leave it and then perhaps it will fully subside. Whether I can take this mucus, white mucus, it in the night, it irritates the throat and you start coughing, and then after gargling, the white mucus comes out.
Yes.
Then it subsides.
What you are doing is correct. Only gargling is the number 1. As far as medicines are concerned, you can give Pulsatilla.
Okay.
Carry bike.
Okay.
These 2 medicines will work for your symptoms.
Okay.
If at all third medicine comes means Antimtot.
Bio number 6 also can be taken.
Bio number 6 continuously you have to take in Delhi.
Okay.
Delhi famous for bio number 5 and 6.
5 and 6.
Yes. The factories are established for that climate only.
Yeah, but now for you is this bio number 6 continuous.
Bio number 6 you have to continue minimum 1 month.
Yeah, 5 stages over now for you.
5 is over. I think 6 only because pollution is there more.
Okay. Thank you, sir.
Okay.
Sir, the same problem is coming now in Kerala also, because the night is cold and daytime is very hot. And the viral load is very high. Even allopathic doctors say the viral load at present in Kerala is very high. So almost everybody gets throat irritation, headache and cough, fever also.
Okay.
Everything will vanish in 3-4 days, but cough remains. Cough is not vanishing.
Okay.
I tried some 3-4 patients. I was giving Bryonia, Antimtot, Arsenic album, but cough is still continuing. It is not going out. Even allopathy doctors say it is remaining for 20-25 days. Can we try any other medicine other than these common medicines we normally give?
Antimtot, Bryonia, phosphorus.
Phosphorus.
Antimtot, Bryonia, phosphorus.
What type of cough is it? Is it a dry cough or a productive cough?
Beginning it will be productive and later on it's becoming dry.
Dry cough. I think spongia also can support, I think, sir. What is, sir?
Spongia, yes.
Yeah.
Spongia. I am coming. 5 drugs are there. Antimplant, bryonia, phosphorus, and spongia, Seneca. These 5 drugs, even Delhi or Calcutta, whatever it may be, any chillness is there in the weather and pollution is there. These 5 drugs you have to think about it. If fever is
about Hipersulf in Hipersulf.
Hipersulf, no, not necessary, not now.
Infection. It is not infection. It is the residual cough.
Yes.
Even ammonium carb also can support.
Ammonium more, ammonium carb. Ammonium more and ammonium carb. Ammonium carb up to upper is only. Ammonium more will go inside also. Lower respiratory tract also.
Yeah.
Okay. Good, sir. We will try that. Yes. Many people
So,
are having
there is some
allergic cough also.
Sir, one more thing. George sir.
In the throat.
Sir, George sir.
Sir, sir.
Your next month program. Moon on third.
Yes, sir, I'll do. I'll do.
Third.
Next month.
Okay.
Yes, sir. Okay.
So second I am coming here. Second I will call you.
Right, sir.
So third I think George sir will take.
Yeah. No,
Thank you.
Balaji sir, we are telling something. What was it?
Yeah, so some people have continuous irritation in the throat here in Delhi.
Yeah.
They will be doing continuously.
No, if that is the case and there is a phlegm productive which is transparent or
There is no to put only dry cough.
dry cough. So again, this it is irritation only.
Yes, sir.
Like like there is no proper medicine required immediately, but even just try Econite, it may work.
Which one?
Aconite.
Yeah, Econite.
Aconite. Okay.
Bryonia, you can try Bryonia with.
Sir, Govind Bharani sir.
Yes, sir.
Your symptoms again, please repeat.
Some people here, I am not having this, but
Oh,
some
no,
people
you
I
tell.
find
Symptoms you
they
tell.
are coughing and doing
Yes,
like
yes.
that. So in that case, can we give Bryonia with Hipersulfa and maybe Pothos?
Yes. Any medicine is available for that same symptom in homeopathy? Several times I talked about it.
Clearing the throat.
Nearing the throat. There are 5 medicines in nearing the throat. One is Mercoid flavum, another is Mercoid rubrum, and Vaithya is there. WEI, Vaithya. Spongia.
Spongia and Bryonia can be.
Like that, Bryonia, Spongia will go hand in hand. Vaithya, WE will be there. You think about it. I think Vaithya only. But excellent remedy. It will work very slowly. But MIF and MIR are the good medicines. Mercoid flavum, Mercoid rubrum. These are good medicines for throat. And Pitaloka always will have any pain is there in the throat.
In some
Pitaloka will.
cases,
Tell me, sir.
Gingiva will
in some cases it also triggers allergic cough.
Yes. Allergic cough, our Anup Kumar has told Aconite
In
is
some
sufficient.
cases it also triggers allergic cough for them.
Yes.
Okay.
Allergic cough, you can give Aconite or Bryonia like that. Any doubts? Time is over.
Especially after the viral fever, it lasting about yeah. Okay, sir.
That is lingering cough.
Yeah.
That Calibic will work. In throat area only. After taking any antibiotics or any treatment in anywhere, the lingering cough is there, you can give Calibic. Along with some other medicine you can give. Rumex will work excellently.
Sir, for these babies of 2 years of age, this 30 potency medicine, we can give 2 globules, 2 pills.
2 globules you give, but more depend on biosalts.
Biosalts. Okay.
More depend. You can give this daily 1 dose, but depend twice or thrice biosalts. Because 2 years girl, boy or girl.
Okay.
Sir, I think we can wind up, sir.
Yes, sir. So, all
Thank
will
you.
meet us,
Yeah.
meet you next week, except me.
Okay, sir.
Thank you. Thank you. Good
You
night,
have a
sir.
safe trip, and we will thank everybody who has attended. And I'd like
Okay,
to-
thank you all.
Thank you. Thank you.
Thank you.
Thank you, sir.